Hey Jags, it's Sarah. Welcome back to Jag TV. I hope you enjoyed the last two interviews that I did with Sarah Boone and Sam McDonald. Today we have an interview with a good friend of mine named Savannah Greene, and she is a nursing student here at South. So today I'm going to do an interview with her, just talking all about what it's like to be a nursing student here and the whole process of getting into the nursing program and what clinicals are like and how things are kind of changing now that we're in quarantine. Hi, Savannah. Thank you so much for joining us today.
Hey, thank you for having me.
So, can you introduce yourself?
My name is Savannah Greene. I'm from Birmingham, Alabama, and I'm currently a junior at the University of South Alabama.
So, why did you decide to go into nursing?
At first, I was not going to go into nursing school. I had my eyes set on somewhere else, but I started volunteering my freshman year at the USA Children's and Women's Hospital. And then there, after quite a few hours there I spent, I decided that I wanted more hands-on time with patients and their families, specifically in pediatrics.
So then why did you choose the program at South in particular?
So I started out my freshman year as a biomed major, and then I switched to biology, and then I switched to nursing. So by the time I had made up my mind about nursing school, I pretty much had my foot into the door here at South, and I didn't want to leave campus. So I heard pretty good things about their nursing program and decided that I wanted to stay at South.
What kind of things did you hear about it?
I heard that their passing rate for the NCLEX was really good. So their numbers were really good for the state, and I based my judgment off of that.
Explain what that is for people who don't know.
Basically, the NCLEX is, so you can pretty much graduate and get your BSN, but that doesn't necessarily mean that you can practice in the state of Alabama. You still have to go after you graduate and take the NCLEX exam. And that's basically a licensure exam to be able to practice in the state of Alabama. And that's also elsewhere. So you can get your nursing degree, but then you'll also have to take the NCLEX no matter where you go in order to be able to get your license to practice.
So then if you don't pass, what do people do?
People just keep taking it.
So there's nothing else you can do if you don't pass it.
There's like different opportunities you have. Like you can, there are different jobs that you would potentially qualify for, but as an RN, you wouldn't be able to practice.
So then what's the process of actually getting accepted into the program at South?
It's pretty easy. I would, first of all, I would say go to the College of Nursing's webpage because they have a really good detailed like webpage of what they expect and what they, kind of how they run and function and everything like that. So I went to their webpage and they have, I think it's just a button that says apply for the traditional BSN route. So you click on the button and then it brings up like a PDF thing, I think, if I remember correctly. And it's basically just a packet that you have to fill out, and it has all the directions. And you can fill out a packet by a certain date to be able to start nursing school in the summer or to be able to start in the fall. And each of those packets will have like a certain date for you to turn that packet in. And then after you've like turn in the packet, there's kind of like, once you get accepted, there's like the like next step process. And that kind of goes on to Castle Branch. Castle Branch is pretty much a big deal to be able to participate in clinicals, which comes later on down the road for nursing school. And it's basically where you have to do a bunch of paperwork for HIPAA, for getting CPR certified. If you don't have your CPR certification, you don't need to do the one at the rec center. They don't take that card for some reason. I don't think it's the like right like certification. So normally people go to like Newman's ambulance company to like get their certification or something like that. So that's what I did. And then also for Castle Branch, you have to get like a TB skin test. You have to get your blood taken. So they'll take about like 3 vials of your blood, and they test your titers and stuff like that. It's basically to protect patients while you're taking care of them as well.
Okay. So walk us through what like a regular week in your life would be like as a nursing student.
Okay, so since things are kind of crazy right now with everything going on, I'll tell you kind of what it was like beforehand. So like while we were in Adult 1 earlier this semester, starting off, it would probably start around 6 in the morning on Monday morning. We'd wake up and we would have to be in class before a little bit before 7:30 in the morning so that we could sign in for our exams. Our exam would start at 7:30 in the morning and run till about 8:30. Sometimes we would have lecture from 9 until around lunchtime, and then we would have a brief break for lunch before we had to be at patient pickup in the afternoon for clinical. And that was for my clinical group. Sometimes patient pickup for people isn't until like Tuesday afternoon, so their schedule would look differently than mine. So we would go to patient pickup, and we would spend a few hours at the hospital. I was really confused about patient pickup to begin with. I was like, oh, that's weird. Like, they're picking up patients from the hospital and doing something with them. Like, what is that? What does that mean? No, it's not that at all. You basically just go to the hospital and get a bunch of information about the patient. Nothing that would compromise HIPAA or anything like that. It's basically just kind of what's going on with the patient and what medications they're taking and such. So basically after that, you would leave from the hospital and go to wherever you want to like complete your work or whatever. Normally I would go leave straight from Providence and go to the library. And from I don't know what time it would be in the afternoon by that point. I would kind of lose track of time. But I would go straight to the library and pretty much be doing homework until 2:30 the next morning. And that's mainly because you have a lot of paperwork to get done before clinical, and it's called like preclinical paperwork. So you have to do your paperwork, and then you also have to learn everything about the medications that were given to you that day, because the very next day you get tested on those medications. So I would complete my paperwork, and then I would start studying for the medications that night. So my Monday basically ran from 6 a.m. starting Monday morning, and would run to like 2:30 a.m.-ish on Tuesday morning. Yeah, and so then I would get done like studying, and I would sleep for a few hours and have to be awake at 5:30 in the morning on Tuesday to get ready for clinical that we have to be at 6:30 prompt. And if you do not show up to clinical on time, then you have to make up that clinical time miss with a whole like extra clinical day. So just make sure you're on time. That's the biggest thing with like nursing school. Just make sure you get to your places on time. And so then Tuesday we would spend 6:30 a.m. to 7 p.m. All day at clinical. And then after that, normally I would go to small group at my church right after, just to give me a break from like class stuff. And then I would end up back at my dorm around like 8:30 and begin more paperwork that is due like Thursday morning at 8. Wednesday morning or Wednesdays, I would normally go into work on Wednesdays and Thursdays, and they were really good about working with my schedule because I work on campus and they're wonderful people. So yeah, so then Wednesdays and Thursdays I would go into work. It would depend on my work schedule because like some days we would get called in for sim or like a clinical skills checkoff on Wednesdays and Thursdays, but they wouldn't tell us what our schedule would be until like that week. So we would just find out about sims like as the week came along. And sims are like simulations. So we would go to like the simulation lab and perform like a different scenario of such for like different patients. And so that would be my Wednesday and Thursday. And then Thursday evening, I would prepare for my class that is on Friday. Because basically we would have like 3 like quizzes on Fridays in a lecture that lasted from 8 to 4:30 in the afternoon. So we would have our lecture on Fridays from 8 to 4:30 with a 1-hour lunch break. And then for the weekend, you basically have like Friday evening, Saturday, and Sunday to study for the exam that's on Monday, or however many chapters you get for that week. So that's basically the schedule. And it kind of just changes, and you just have to kind of be flexible with it because that's what you're in school for, and that's what they tell us. So, you know.
You have to learn how to live on no sleep.
Yeah, basically. I think that was probably one of my hardest things. Is the sleep part got me at first, because I need sleep to function, but coffee became my best friend. So, you know, we're kind of running off coffee. I have some coffee right now. So, you know, you make it work. You learn how to make things work. And sometimes, like some clinical weeks, I wouldn't be up till 2 or 2:30 in the morning on Tuesdays or whatever. So that was nice. But for the most part, Monday nights always ran super late because of the paperwork that needed to get done. So,
Do you have any tips on dealing with time management and trying to manage to get enough sleep?
yeah, I would get a planner for sure. That sounds like so cliche. But whenever you have like everything written out in front of you, it's really easy to be like, oh, like I can check this one thing off first, and then I can get to A, B, C, or D. And then also, like I said before, being on time for your exams, for your simulations, for your clinical time. That's one of the biggest things because they don't want people like slacking off or anything like that, which is completely understandable because you can't show up late to your shift in the hospital. Like that's not acceptable at all. So yeah, I would get a planner and make sure you're on time for different stuff.
So when you first started clinicals, tell us about what that was like. Like on your very first day, what were you going through? What were your emotions? Tell us what the day was like.
So I didn't sleep at all. My first clinical day, that Monday, I didn't know what I was doing with my paperwork, mainly because they even had like a whole lecture on like how to do this paperwork and everything. But I'm really bad at second guessing myself, mainly because like I'm a type A personality, so I'm very like harsh on myself. And so I was trying to fill this paperwork out, and then I was thinking about pretty much like going into clinical. Like I was horrified. Everybody was basically horrified because they were just like nervous for like what to expect. This was going to be our first patient interaction. It wasn't just some like fake person acting along with us. They were actually like, you know, in pain and different stuff like that. So I didn't sleep at all, mainly because I was too nervous and or excited for clinical. So basically I got to Providence probably around like 6 that morning, walked in and met up with my other like people for clinical group. And our clinical instructor, her name was Miss Langley, and she's a wonderful clinical instructor. So if anybody ever gets her, they're going to be lucky to have her because she really cares about the success of her students, not only in the classroom, but outside of it as well. So we had her for our clinical, and she made it as easy as it could be for the first day, but it was not like, I would not say I had the best first day clinical experience because I was really overwhelmed with everything that was like going on. It was kind of just like, you know, we weren't fed to the wolves or anything like that, but it was just an eye-opening experience to say the least. But not to make anybody scared or anything, the next week for like clinical 2 week or whatever, it was way better than the first week. And it was more so because I actually got sleep the night before and I actually kind of knew what to expect. But yeah, the first week was kind of threw me off my game completely. So I would say that people expect one thing, and most of the time going out that first day, you're just like, whoa, that wasn't what I was expecting at all. So it was good though. In the end, it was good.
What does South do to really prepare you guys to be ready for going to clinicals?
So clinicals don't start until the second semester of nursing school. The first semester, so the curriculum has kind of changed. I know that I started in the summer and I started with clinical skills and health assessment. And then I just had to follow up in the fall with pathology, pharmacology, med administration, and I took an extra class called evidence-based practice to knock it out of the way. But they also have now implemented a first semester clinical experience, and I think they went into the nursing home or something like that to kind of get a feel of things. I think that was probably beneficial for people to have before just going into adult one clinical without any experience under their belt. But so I would say that clinical skills really helped me for clinicals, obviously because you learn like all the skills you're going to be doing in the hospital. And I'm a hands-on learner, so that class, I love that class. I had a lot of fun in that class because we were able to actually like perform stuff and kind of see how stuff like gets done and everything like that. But all the like first semester classes tie in together. So I wouldn't say that one class is more important than the other, because for pathology, you have to know how diseases work to understand what the person's going through. For pharmacology, you have to understand the effects and the reasons why people are on the drugs that they are on. Health assessment, it was basically more geared towards how to ask patients like questions and different stuff, how to like perform tests on them to see kind of like what they're experiencing. And med administration was more along the lines of, they also call it dosage. So people will hear dosage being, that class is what it's called. And so dosage is kind of like med math, I would say, for people who've never taken it before. You learn how to calculate how much drug to give of a certain drug to to a patient. But yeah, like I would say that I was prepared as much as I needed to be to go into the first clinical day, even though the first clinical day I got overwhelmed. There's always going to be a sense of like, oh, like I still don't feel like I know what I'm doing, because you pretty much don't. Nursing is a career that you learn something new every single day. And if you don't learn something new, then that's kind of a problem, because there's always something new to learn. So that's one thing I love about nursing, is that there's always something new to learn.
Is anyone in clinicals right now, or are they not doing that right now?
They're not doing that right now. We are currently, we're in our psych class right now, for me and the people I know. And we have like the lecture-based like class is kind of, it's like a theory-based class. So for theory class, we have it's kind of like a lecture class. So that's done online for Zoom. And that class is on Mondays. We had that class this week, Monday, for about 6 hours. We took about 3 tests, and then that took about 3 hours. And then the like second half of the class, which was another 3 hours, we basically just reviewed kind of the concepts of the reasons why the tests were the way that they were. And then for the clinical component that we're supposed to be doing, because the Board of Nursing like requires a certain amount of clinical hours that you're supposed to do to be able to even get licensed. We are basically we thought it was going to be a lot of different stuff at first. Nobody really knew what was going on, because this has never happened before, obviously. So we were getting told a lot of different stuff, a lot of different things along the lines of, oh, like it's going to be recorded, patients are going to be recorded, and like acting scenes will be recorded, and we'll get sent them, or we'll get case studies, or we'll get like an online simulation type ordeal. And basically right now what we're doing is just a ton of like paperwork, pretty much. I would say it's like, we go online and we watch these videos that have been pre-recorded by actors, and they have an actor as a patient and an actor as someone who would be the nurse, and the nurse is like asking them questions and different stuff like that, and you fill out your paperwork to the best of your ability that you can.
So what advice would you have for a prospective student thinking about joining the nursing program at South?
That's a hard one. I would say, obviously, do it. And it will probably be one of the hardest things in your entire life that you've ever done, but don't give up, because there's light at the end of the tunnel. I had actually watched or heard a recording of a nursing panel that had been done, and they had their things to say about like different things they had, and it truly scared me. Like I was like, I don't know if I want to go into this nursing program anymore, because it was so much like scary stuff. But there are so many life lessons to be learned out of this program. And I think one of the biggest things is that it can turn you into the most hardworking person that you never thought you could be in the first place. Also, I would tell them that it's really important to not give up, because you're going to be studying for hours and hours and hours and doing hours and hours of work. And it might not always go how you want it to go. I am really good at, as I said before, hands-on stuff, But I can study hours on end for an exam and then get into the exam and just totally like lose my marbles because I get freaked out over something. And so um, sometimes I don't make what I want to make on exams, and that kind of beats me down. But at the end of the day, you just have to give it your best shot. And that's what you have to go off of. Just know that as long as you worked your tail off to get there in the first place, that's all you could do in the first place. So you just got to keep trucking along until you get there to your destination. So also another thing I would tell people is to find at least one person in the nursing program that is in their cohort to stick with, mainly because they know what you're experiencing, they know what you're going through. They're going through the exact same stuff as you are, professional wise. And so they understand the stressors of nursing school, and everything that comes along with it. And so it's really good to have someone to encourage you and support you along the way, just as you can do for them.
So what is your personal plan? What do you want to do after you graduate with your nursing degree?
I'm not sure. I had life figured out. I would say probably a year and a half ago or 2 years ago, I had my life figured out, and that I knew exactly what I wanted to do in life. But things change. I'm still interested in pediatric work, but I'm not really sure how that's going to go because they're saying that we're going to have clinicals this summer, but we're not entirely sure if that's going to end up happening. So that would kind of take away from the clinical experience opportunity to have. So I don't know. We'll see. I don't know. My first step is just to get through nursing school right now, because that in itself is a challenge. So I'm going to get through nursing school, take the NCLEX, and hopefully get through that. And then I guess we'll just see where I end up.
All right. Well, I wish you the best of luck in your journey in nursing school. It seems really hard. I definitely would not be able to do it. So props to you.
Yeah, thank you.
But thank you so much for joining me, and I will talk to you later. Thank you.
You're welcome. Bye-bye.